Hello students, welcome to classroom. In today's class, we will be talking about some more eye defects which are mentioned in the textbook. So we will be talking about presbyopia. So let us learn together what presbyopia is and how what are their causes. Okay, so let us get into the topic now. So presbyopia. What is presbyopia? Now C class, it's gonna be like this. The power accommodation of our eye, okay, the power accommodation of our eye gradually decreases with aging. So as we age, now see, all of us, we will age. Okay, we will age. Your age will increase. Okay, you are in class 10. Suppose you're in class 10. So according to the board, you have to pass out your class 10. If you have never failed, you should be passing your class 10 by 16 or 15 maybe. Okay, so 15, 16. So but you will grow up. Okay, your age will increase to 16, 17, 18, 19, 20. It will go on like that. Okay, so you will become an adult and you'll become, okay, a father, mother one day. So you will age, and as you age, even your eyes will age. Yes or no? Okay, every part of your body will age. Similarly, okay, your eye lens also, as we grow old, becomes weak. Okay, it becomes weak. So the eye muscles, which are the ciliary muscles, they become weak. And when the ciliary muscles become weak, the eye as a whole, the eye lens as a whole also becomes weak. So the flexibility of the eye lens diminishes. Okay, it's because of the ciliary muscles that the eye lens are flexible. It can increase its curvature, it can decrease its curvature. It can increase its curvature, it can decrease its curvature. This flexibility of increasing and decreasing its curvature, okay, this flexibility of the eye lens, okay, this is called the flexibility of the eye lens. This is all possible because of the ciliary muscles, because the ciliary muscles are attached to the top and the bottom. So the ciliary muscles will compress. When the ciliary muscles compresses it, the curvature increases. When the ciliary muscles releases their tension, okay, when they become relaxed, then the curvature will decrease. Okay, so this flexibility of the eye lens decreases, okay, with aging. So presbyopia, okay, is also known as old age hypermetropia. All right, presbyopia is also known as old age hypermetropia. Now hypermetropia, okay, so I have just mentioned hypermetropia. Now we have already discussed what hypermetropia is. So hypermetropia is a defect of the eye whereby the person cannot see nearby. Okay, the person can see far object without any problem, but the person cannot see nearby object. Now here in presbyopia, okay, an elderly man or a woman, okay, most probably, let's take the age gap of say 50 to 60. Okay, now 50 to 60 years, okay, man or woman, okay, man or woman or woman. Now this man or woman, when they were young, they had no eye problem. Okay, they never wore glasses throughout their entire life. They had never experienced any eye defect. Okay, even in their childhood days, they never wore glasses. But the same men and women, as they age, what happens? A time will come, okay, may not come to everybody, but maybe, okay, as we age, gradually it will come to everybody. So a time will come, a time has come when, okay, this man or woman now will have problem seeing near, okay, problem seeing near, okay, but they are able to see comfortably far object. But when it comes to near object, they are not able to see properly. You know why? Because whenever they try to see near object, what happens to our eye when we try to see near object? The lens has to increase its curvature. Yes or no? Okay, the lens has to increase the curvature because you are seeing a nearby object. So the focal length has to be shortened. So the focal length has to be shortened. So in order to decrease the focal length, so the lens has to increase its curvature. So if the lens increases the curvature, the focal length becomes near. Okay, and this is how your eyes are currently right now, okay, when you're looking at nearby object, I'm looking this marker at a very close distance, maybe roughly 25 centimeter. So the focus of my eye is very near. My focus has shrunk, and then it helps me see in detail whatever markings are written on this marker. Okay, and when I see far object, what happens? This focus will not work for far object. When I see far object, this focus has to increase. So the focus has to increase. Okay, the focus has to be sent that far. So what happens? My eye lens has to relax, isn't it? Okay, so my eye lens has to be stretched. When the ciliary muscles are relaxed, the eye lens gets stretched, and this is how the focus is shot far away. Okay, and then if I want to bring this focus close by, this is how my lens should be. The lens cannot remain like this. The lens has to increase its curvature. So if the lens increases its curvature, this focus point gets closer and closer and closer. All right. So an elderly man or woman, okay, after attaining age 50, 60 like that, okay, they will experience this presbyopia. So at this age, they will have problems reading the newspaper, reading a novel. Okay, so they are not able to see nearby objects. Okay, they are having a difficult time reading. Okay, but they have no problem seeing far objects. Okay, this is called presbyopia. Okay, it comes with aging. It comes with age. It doesn't happen to. It will not happen to a kid. It will not happen to a young boy or a young girl. Okay, but at a certain age, what happens? The person may develop this problem whereby he or she is not able to see nearby object. So that condition is called presbyopia. I hope you are clear with what presbyopia is. Okay, this is why it is also known as old age hypermetropia. It's hypermetropia, is it not? What is hypermetropia? In hypermetropia, the person has problems seeing near, but has no difficulty seeing far. Similarly, here the elderly man is having problem reading the newspaper, whereas he has no problem spotting the car which is roughly maybe 100 meters away or 500 meters away on the highway. So he has got good far vision, but he has got poor near vision. So this is basically hypermetropia. So he is suffering from hypermetropia at a certain age. That's why this is also known as old age hypermetropia. So presbyopia is also known as old age hypermetropia. Alright, so let's write the definition. So the definition of presbyopia, definition. So what will be the definition of presbyopia? The power of accommodation, of the eye gradually decreases. I hope you are all taking down notes. Decreases with age. So the power accommodation of the eye gradually decreases with age. For most people, the near point, very important, underline this word, the near point, which means the ability to see near. Okay, the near point recedes away. Okay, means it disappears away. The near point recedes away. Thereby, the person has difficulty seeing nearby object. This condition is known as presbyopia. Okay, so this condition is known as presbyopia. The definition is very clear. The power of accommodation of the eye gradually decreases with age. For most people, the near point recedes away. Thereby, the person has difficulty seeing nearby objects. Okay, nearby objects. This condition is known as presbyopia. So everything is very clearly mentioned here. Okay, so this is the definition. Then, since you are writing notes, I'll give you in detail. Then the causes. The cause also, let's write down the cause. So the cause, let's write down the causes. Roughly we'll take out two causes. Cause number one will be the decrease in flexibility. The decrease in flexibility of lens. So I already told you earlier that when you are young, your eye lens can be like this, can be like this, can be like this, can be like this. Okay, this flexibility is here. Increase the curvature, decrease the curvature, increase the curvature, decrease the curvature. This flexibility of the eye lens is here when you're young. Okay, but if you grow old, this flexibility decreases. Okay, so point number one, decrease in flexibility of the eye lens. Okay, point number B. Okay, point number B is the gradual weakening of the ciliary muscles. So what does this point mean? Gradual weakening of the ciliary muscles. What does it mean? It means that as you age, your ciliary muscles are getting weaker and weaker, and there is nothing much you can do about it. Eventually, every part of our body, okay, their potential decreases, their functionality decreases. So with age, everything will start failing. Okay, so old age is a very difficult time. Remember that. So old age is not easy. It's going to be very harsh on each and every one of us. All right. So just like that, the ciliary muscles also, when you are young, they are active, and that's why you are able to. That's why it gives you a good flexibility in your eye lens. But when the ciliary muscles are weak, what happens? This flexibility will be affected. Okay, so this is the second point. Okay, so this is everything about presbyopia. Okay, now to continue the discussion, sometimes a person may suffer both from myopia and hypermetropia. So in a very rare case, but it happens that a person may suffer both from myopia and also hypermetropia. Okay, so there are cases like that. So if a person suffers from both myopia and hypermetropia, then is there any way, is there any correction for that? The answer is yes. So a person suffering from myopia and hypermetropia, okay, there is a correction for that. So what is the correction for such a person who is suffering from both myopia and hypermetropia? A person suffering from myopia, okay, we know that has difficulty seeing far. And a person suffering from hypermetropia, we know that has difficulty seeing near. So this person who is suffering from both hypermetropia and myopia cannot see near also, cannot see far also. Okay, near vision also bad, far vision also bad. So how do we help him? So there is a help for such a person. There is a help for such person. The help is that the person should wear bifocal lens. So correction for person suffering from both myopia and hypermetropia. What is the correction? The correction is bifocal lens. Okay, class? The correction for a person suffering from both the defect is bifocal lens. Now, what is this bifocal lens? Bifocal lens is a lens which has got both the types of glasses. Okay, so let me show you. So let's say this is the lens glass, sorry. Then Now in bifocal lens, okay, so let's just make it like this. So the bottom part will be convex and the upper part will be concave. Okay, so this is the concave glasses and these are the convex. Such type of glass, okay, such type of glass are called as bifocal lenses. They have got both the type of glasses, upper part concave and lower part convex. Now you tell me the lower part is convex, so this will help him see near or far. What is your answer? Pause the video and think. Yes, the answer is it will help him see near. Okay, convex. Okay, convex helps you see near, and then concave will help the person see far. Okay, so next time you see an elderly person, okay, you check him out, okay, and try to identify whether is he wearing a normal concave lens or a normal convex lens, or is he wearing a bifocal lens. Okay, try to sort it out. Okay, so try to find out bifocal lenses in real world. Okay, so this is everything about presbyopia. Then now we'll discuss about cataract. So cataract, what is this cataract? Now cataract is a condition of the eye, okay, in which the transparent crystalline lens becomes milky, okay, or cloudy. Now you see, sometimes what happens is that the crystalline lens of people at all age, remember class that it happens at all age, okay, even presbyopia happens to people at all age, and similarly cataract also happens to people at all age. So sometimes the crystalline lens that we have in our eyeball, okay, at all age, okay, what happens to this crystalline lens is that it becomes milky and cloudy. This condition is called cataract. So cataract is a condition which happens at all age. So this also happens at all age. Okay, cataract will not happen to you. Okay, cataract may not even happen to me. So cataract will not happen to anybody who is young. Okay, maybe not even to an adult, but definitely cataract may happen to us, okay, if we grow old. So it's a condition which happens at all age, in which the eye lens becomes cloudy or milky. Okay, so in cataract what happens is that the transparent eye lens that we have, this is the transparent eye lens, which we have, turns or becomes what? It becomes cloudy or milky. So it becomes cloudy or milky. So cloudy or milky. Okay, so the lens which is transparent becomes like this. Reason? What would be the reason? There should be a reason, isn't it? Reason for this, reason why the lens is becoming cloudy or milky, reason is because of protein accumulation. Now this reason may sound odd to you, but it is true. Okay, the reason why the eye lens is becoming cloudy or milky is because of protein accumulation which is taking place in the cells, okay, which make up the eye lens. Now why is it even happening? Okay, why Why is this protein accumulation taking place? Why the accumulation of protein? Now see, the answer is very practical. Now as long as we are young and energetic, our body, the protein that see, we eat food and then we get a lot of protein from the food we eat. Meat is a rich source of protein, egg is a rich source of protein. So the protein that we consume, we consume, is used for building up body. Okay, it helps you to grow, repair cells and all that. Okay, but as we grow old, okay, our metabolism decreases. So now when we grow old, our locomotion, our movement also gets restricted. We don't move around a lot. We stay in one place put, okay, and then we don't move out a lot. We minimize our physical activity, and then we are mostly bedridden, or we don't do much physical sweaty works. So what happens is that the little food that we eat also, the protein present there, the body has nowhere to use it. So it just randomly distributes here and there, and then even, okay, the eye cells also gets this protein, and so now protein accumulation takes place in the eye lens. Okay, this is why this defect, this problem arises to old people. Okay, it doesn't arise to young people, because young people are very active and energetic. So okay, protein accumulation is quickly absorbed to help you grow, to help repair your injuries. But for an old person, okay, they stay at home and then they don't do much work. So because of that, the body, the protein which is present in the body, okay, is transported to different places, and even the eye muscles, okay, they also get some. The eye cells also, the cells which make up the eye lens, they also get some, and they start accumulating protein, which makes the transparent eye lens become cloudy or milky. So I hope you know, or you know now why accumulation of protein is taking place. Okay, so the reason is because of protein accumulation. Now, so the defect is already here. So what is the cure for this? Is there a cure for this? Yes, there's a cure for this. So the cure for this will be to undergo surgery. Okay, so cure will be surgery. So we have to go surgery. So we have to go to the doctor. And what will the doctor do? Well, the doctor will have to cut open, okay, your eye, and then remove the lens, okay, and then reinsert artificial cellulose lens. Okay, so the doctor will insert artificial cellulose lens. Your lens has already become cloudy and milky because of protein accumulation, so this will be removed, and then the doctor will reinsert artificial cellulose lens. Okay, so that's how the cloudy milky lens, which is preventing you from seeing clearly. Now, do you think that you will be able to see clearly with such with this accumulation in the eye? No, you will not be able to see clearly. Okay, and if you go and observe carefully into the eye of an old person, you will see this. Okay, it's visible also. They will have, okay, right now if you look into your pupil, okay, your pupil will be dark brown. Okay, but in old people you will see that there is whitish, okay, whitish substance being accumulated. This is cataract. Okay, that will be definitely cataract. This is what is being accumulated there. Okay, cloudy milky. Okay, this is protein being accumulated there in your grandpa's eye or in your grandma's eye. Okay, next time you visit your grandpa, grandma, you can check that. Okay, and tell them it's cataract. Okay, then that is happening because protein accumulation is going on. So you can help your parents, you can help your grandparents by taking them for surgery. Okay, by undergoing surgery, definitely. Okay, if this is removed, then they'll be able to see. They'll be able to see through. But I am told that again, okay, again accumulation will take place again. So it has to be a routine visit to the surgery. So it will be like that. So the cure is to go for surgery and then to remove it. Okay, which will help you see. Okay, which will help you see again. So this is it. Okay, two small topics were there, presbyopia and cataract. So cataract is a condition of the eye which happens at all age, in which the eye lens becomes cloudy or milky. Okay, the transparent eye lens becomes cloudy or milky. Reason is because of protein accumulation. Why is protein accumulation taking place? It's because we become inactive, okay, as we grow old. So our activities decreases, thereby the body, well, whatever protein is present in the body, the protein has to be distributed, and then the eye cells, the lens cells also, they get some. So protein accumulation starts taking place even in the lens. Okay, and then cure for this is to undergo surgery. These days, because of advancement in medical science, we also get laser surgery. So laser surgery can also help remove this, or we can go to our old methods, which is go for surgery. Okay, so if we go for surgery, the cloudy milky lens will be removed, and then artificial cellulose lens will be inserted. Okay, so this is it, class. I hope you have all understood. I'll see you again in the next video. So until then, take care and have a good day.